Hi, I'm Kelly Mayer, licensed clinical social worker, and today's topic is maternal mental health. Now, maternal mental health is it's a huge passion of mine because I am a mother to four children. I have a 1-year-old, a 4-year-old, a 6-year-old, and a 10-year-old. So I really enjoy working with other moms to try to overcome some of these postpartum issues that they may be helping. I really enjoy this topic very much. And so, with maternal mental health, there are four different issues that a mother, either pregnant, in the postpartum period, or postpartum period can really even include like when a child is 1 or 2 years old. So there is postpartum depression, postpartum anxiety, postpartum obsessive compulsive disorder, and postpartum psychosis. And so today I'd like to talk a little bit about these four common issues to help you become a little bit more aware of them. And then I am also going to talk about some resources for postpartum issues, and also what types of things that we would typically do in therapy sessions with a postpartum client. So, postpartum depression, it used to affect about 1 in 8 women. But unfortunately, with COVID during the last several years, and also a lot of isolation over the past several years due to COVID, the statistic has actually increased by 40%. And so the new statistic is actually 1 in 5 women are now experiencing postpartum anxiety and depression symptoms, which this is a very high statistic, probably the highest that it's really ever been in many years. And so with postpartum depression, the DSM criteria would be that a new mother or pregnant mother would be experiencing depressive symptoms most or all days within a period of 2 weeks or longer than 2 weeks. So these symptoms would be things like feeling sad, feeling empty, having difficulty bonding with their baby, doubting their mothering abilities, and really having, just low confidence, low self-esteem with, how they're taking care of their child. They may be experiencing feelings of guilt, worthlessness, hopelessness, loss of interest in activities that they used to enjoy. They often experience fatigue, difficulty with sleeping. Even if the baby's asleep, they may not be able to fall asleep because they're feeling too depressed. They can have difficulty with making decisions, appetite changes, physical symptoms like GI issues, cramps, headaches, those types of issues. And so overall, the mother is just feeling sad and just really disconnected to their child, and just really struggling with bonding and taking care of their child. And postpartum depression, it is more common with the first child, but it does also occur with subsequent children as well. And it is also common sometimes a woman might have postpartum depression with one child, but then not necessarily with another child. And then moving on to postpartum anxiety, it does have pretty similar symptoms to what I just explained about. But of course, it's more the mother is spending a lot of time worrying, feeling very anxious, but it does still have a lot of the similar issues of, worthlessness, doubting their ability to mother, having difficulty bonding with the baby. The mom might have certain concerns such as, is the baby eating enough? Is the baby sleeping enough? Am I really doing this right? They might have difficulty with juggling if they're siblings, worries about how the siblings are, dealing with this new transition. That can be very common as well. Some of the worries, maybe about their baby dying, could be worries about their baby having SIDS, or their baby getting some type of disease or just some type of accident happening to their child. And so the mom is just spending a lot of excessive time worrying about all these things, maybe just doing a lot of reassurance seeking, spending a lot of time on the internet just Googling like excessively about what they should be doing, what's the best way for the baby to sleep, what's the best thing to feed the baby. And now, of course, some of this, in a moderate amount would be very normal. But for postpartum anxiety, the key is that it's really excessive to where this is taking up so much time of worrying and ruminating about these issues that it's really impacting the mom's ability to really take care of her child and be able to function and be able to just have basic self-care of herself, so that she's able to function well enough to care for her child or other children in the family. And then also related, postpartum obsessive compulsive disorder. And it is possible. Sometimes moms really kind of have a little bit of a mixture of these three. So it's not necessarily that you have to only just have one set of symptoms. It really can be a little depression, a little anxiety, and also a little OCD, kind of all mixed in there together. That it does sometimes present in that way. So with postpartum OCD, the mom would have a lot of these similar issues of anxiety and excessive worrying, but it is usually more about a specific theme. So for postpartum OCD, it usually presents that the mother has really like one big fear, and that might be the baby dying, maybe the baby drowning, maybe the baby having SIDS, or the baby getting some type of disease. Those are pretty common themes for postpartum OCD. And so the mother is spending an excessive amount of time worrying about these things, but then also is developing compulsions. And compulsions are different behaviors that the person does in order to try to neutralize this anxiety. So for postpartum OCD, a really common one would be excessive checking. So for example, maybe the baby is taking a nap and the mother is checking the baby every 5 minutes. And if the mom is checking the baby every 5 minutes, she's not going to be able to take a nap and she's not going to be able to get anything done. Maybe the mother is checking the baby's heart rate or oxygen levels multiple times a day because she's so worried about the baby dying. Those are really common ones that I've had clients with before for postpartum OCD. But I mean, there really could just be really any type of just compulsion that the mother could be doing. It may be compulsions that don't necessarily even make a lot of sense. The mother is also might be having intrusive thoughts. So for postpartum OCD, about 50% of those mothers have intrusive thoughts about hurting their child. And so it can be very difficult for mothers to reach out for help, to actually share with others that they're having these thoughts about hurting their baby or about hurting themselves. Because there is, of course, a lot of stigma with that, and the mom might be worried that somebody's going to call the police or child protection services on her. But the good news about postpartum OCD is that with these intrusive thoughts, just like the same as intrusive thoughts with somebody with regular OCD, they are intrusive. And so these mothers who have postpartum OCD, they don't actually want to hurt their child. And in fact, they're very distressed and they're very upset by these thoughts that are just popping into their head. And so common thoughts that I've had clients with that experience this, but common ones could be things like throwing their child up against the wall, stabbing their child, smothering their child, shaking their child, throwing their child down the stairs, these types of things. And of course, these are very terrible things that I just mentioned, but with the OCD for postpartum, the key is that this is anxiety and that this is a fear of these thoughts. And again, that when the client comes to therapy, they're saying that they have absolutely no intention of hurting their child. And in fact, they're doing a lot of compulsions to, in their mind, try to make sure that their child is safe. So, for example, they might not put blankets on their child because they are so concerned that somehow the blanket is going to slip and get over the child's mouth. With the stabbing, maybe the mother is not able to use knives. Maybe she actually got rid of all the knives in her house because she was so worried that she might lose control and stab the child. With the shaking fears, maybe the mom just stopped holding the child. Maybe she doesn't want to be alone with the child anymore. Maybe she's making sure that family members come over because she feels more comfortable having somebody in the house because she's worried about being alone with the child. And so the mom is just experiencing a lot of these thoughts, and the thoughts can be more of images, like still images, or they can also be more like movie type thoughts where it's actually like a movie of the mom like harming the child. It can really present as either way. And so that's some basic just symptoms of the postpartum OCD. So it would typically have more of a specific theme to the worry, and then in addition, compulsions, which compulsions can either be avoidance or checking, reassurance seeking, those types of things. But again, the key is that this is really excessive and it's out of proportion to the actual situation, and it is more excessive anxiety than the typical average person would be experiencing given the symptom. So that's really the key to figure out if this is more of a mental health problem or if this is more of your typical worry, baby blues, just kind of feeling a little bit sad and anxious about all these changes. And so the last mental health disorder would be postpartum psychosis. So you may have heard of postpartum psychosis in the news because, unfortunately, there's a lot of sometimes tragedies that happen due to mothers experiencing postpartum psychosis. But postpartum psychosis actually only affects 0.1 to 0.2% of new mothers. So it's actually not very common. So it is more likely in mothers who have previously been diagnosed with bipolar disorder, and also with mothers who previously had a psychotic episode, or just any of the psychotic mental health illnesses such as schizophrenia or just psychotic episode. And so with postpartum psychosis, it usually occurs within the first 2 weeks of giving birth, and it's characterized by the new mom having delusions, hallucinations, paranoia, rapid mood swings. So the mother may just have beliefs that are not true, or she may be seeing things or hearing voices. And so that is postpartum psychosis. And so sometimes postpartum OCD will get misdiagnosed as postpartum psychosis. However, just statistically speaking, postpartum OCD is much more common than postpartum psychosis. And so it's very important, if you or someone you know is experiencing these symptoms, to reach out to a medical doctor, a psychiatrist, a therapist, or if you feel that you're in immediate danger, to just go to the nearest emergency room. Because the professional really needs to do a proper assessment to figure out what exactly are the symptoms going on and which of these four disorders is the mother having, because treatment for postpartum psychosis is going to be a lot different than just your typical, postpartum depression, intrusive thoughts. So it's going to be two totally different treatments. And so now I'd like to talk about resources and helpful things that you might do in therapy if you had these issues and decided to come into therapy. So, one option is medication. Medication can actually be very helpful for new moms. We can definitely do a lot in therapy, but sometimes the symptoms are really so severe and the mother doesn't have a lot of time and energy to focus on trying to work on these coping skills. And so, medication can be very helpful to see your doctor and see if they would recommend either an antidepressant or an anti-anxiety medication. And then, of course, for postpartum psychosis, they're going to do some type of psychotropic medication. Um, in addition to, possibly considering medication, treatment would typically be cognitive behavioral therapy. So some things that would be discussed in therapy would definitely be an assessment of all the symptoms going on, because the therapist would want to differentiate. Is it postpartum anxiety? Are you having intrusive thoughts? Are you having compulsions? Or is it really more of just only depression and there's really not any anxiety? So that would be kind of one of the first steps that would happen in therapy, is just an assessment of what exactly are the symptoms so that a therapist knows what to treat. So with depression, we would definitely do cognitive behavioral therapy. We would be challenging these depressive thoughts. We would be providing homework, trying to talk about any type of behavioral change that can be made. It's very common for new mothers to feel very isolated. They might be at home with their child. They don't really have anybody to talk to. Maybe their spouse works a lot of hours. They might not have a lot of friends, or maybe their friends are working, or maybe they're in a new city. They might not have any extended family members nearby. So a lot of times, these new moms, they're feeling very lonely, and so therapy can be very helpful because it's once a week, and they have somebody that they can talk to about what's going on, and just to really open up and share. And that can be extremely helpful with somebody who is dealing with postpartum anxiety, just to have that time to really vent and talk about how they're having a difficult time caring for their child, getting used to these new changes, and they're not really sure what they should be doing. And so therapy can be extremely helpful in that instance. The therapist can also encourage them to try to get out of the house, maybe try to join a new moms group, or go to library story time, or do these things to try to eventually get their depression symptoms managed enough that they are then able to get out of the house. Because of course, when somebody is depressed, it's extremely difficult for them to leave the house and go somewhere. But what we talk about in therapy is that the depression is making them not be able to do the very things that would help to get rid of their depression. And so it becomes a snowball effect as the depression goes on and they become more and more isolated. So the therapist can really offer that encouragement and that support to try to help them problem solve, things that they could maybe do to get out of the house, or maybe to reach out to a new friend, because that's very difficult for somebody to do when they're depressed. So the therapist can help to provide that support and that encouragement, as well as challenging these depressive thoughts, using CBT and just talking about different cognitive distortions, which are kind of different ways of thinking that depressed people have. And we can help them to identify those and then challenge those, and then just continue assessing their symptoms and providing that support. With postpartum anxiety, we would also be doing cognitive behavioral therapy to challenge the anxious thoughts, challenge the excessive worries, and then again, try to help the client with making behavioral changes, to try to implement things like self-care in small ways, because that's really hard for new moms to have a lot of self-care. Maybe the mom's very anxious about leaving the baby with their spouse or with a family member, and so we can help to discuss those anxieties and challenge those anxieties and really help to process what the client is going through, to just encourage her to try to reach out and do some of these things that she used to do that she stopped doing due to the anxiety and to the depression. And with the postpartum OCD, we would also be doing the CBT, like I mentioned, but then we would also do what's known as exposure and response prevention therapy. And that's very helpful for intrusive thoughts and for compulsions. We talk about what's going on and we make up a plan with weekly homework. And our goal is to work on reducing the compulsions, but we do that in a really gradual way. So we might work with the mom, maybe she's checking the baby 20 times at night. And so maybe I might work with her during a session and she might agree this upcoming week for homework, she's only going to check on the baby 15 times during the night. So we've cut that back by 1/4. And then maybe if that goes well, the next week we might go to 10 times, 5 times. And then maybe we talk about it and she decides that, 5 checks is actually okay. She's getting enough sleep. She feels better. She's happy with that progress. She doesn't necessarily want to go to 0 checks. And I might say, hey, that's fine. So those are just some of the different treatments for these postpartum issues. There's also a lot of really great resources out there for maternal mental health. And so I'm going to link a few websites in the description so that you can go ahead and access some of those resources. And so if you found this video interesting, just feel free, like, comment. You could go over to my YouTube channel and hit subscribe. Let me know what you thought about this video, but I hope this video helped to provide information, statistics, and just general awareness of some of the maternal mental health issues and what the treatment options look like.